you can be covered for mannequins and Simmen. I did call them personally because some of the doctors wanted to inquire and they couldn't reach them because it was lockdown time, and that's why I kind of approached them myself and I asked them. They were even, if a group of 10 goes, something like that, they were even, you know, kind enough to give a discount.
All right. Thank you so much, Dr. Asia.
You're welcome, doctor. Okay, doctors. So here we go. We start our session today. I will be able to answer your queries and your questions at the end if it is Plab 2 stations or if at all it is regarding my course. All the queries will be answered at the end. Okay. Now I'm going to mute everybody, doctors. All right. Okay, doctors. So doctors, this meningitis prophylaxis station, previously, it came as, doctors, please hold your horses. Please do not scribble on the screen, okay? It will actually be diverting my attention, all right? Okay, so doctors, previously, it was not a phone consultation. Now they have turned it into a phone consultation, okay? Now, one advice, okay, whatever stations where the patient is not unwell, okay, very unwell, where patient is stable, for example, your follow-up stations where patient is coming for a blood test result, okay, all those stations, doctors, for example, ductal carcinoma in situ as well, yesterday it came as a phone consultation. So doctors, please expect any of the stations, okay? In my previous session, I did mention that they repeat the stations, okay, in exam. So it was just coincidence that I mentioned about the ductal carcinoma in situ the other day, and then it appeared again yesterday, okay? So one thing, take home tip, that please, whatever stations are appearing recently, revise them first, okay? They should be your first priority because some of them can repeat. All right, now, as I'm saying that some of the stations where the patient is not acutely unwell, especially the follow-up stations where patient is coming to take the blood test results or scan results, or any stations where patient has a particular concern, okay? Now the concern can be that they are worried about something. Doctor, for example, doctor, am I going to develop stroke? Doctor, am I going to develop dementia? Doctor, am I going to develop meningitis? All these stations, there are chances that they can turn these stations into a telephone conversation. All right, so please make sure you are hands-on with them if you are appearing in the exam recently, okay? If you are going to appear in coming months. All right, doctors. Now, meningitis prophylaxis, as I said, was also not a phone consultation. Now it is. So we have to approach it as a phone consultation. I know previously I have done just a whole session with you as a phone consultation, but today let's revise it again, because when I do mocks with doctors, one thing that I notice a lot, that doctors do not actually do their introduction properly in phone consultation especially. They are stuck because most of us, we are so used to of the same old introduction. Some doctors are even practicing in last 6 months and they have been practicing in the same setting, for example, okay? They are not, because previously there were only 4 to 5, you know, in 300 stations, there were about 4 to 5 stations only, which were phone consultations, right? So doctors, please make sure that you, especially the introduction part, because if you are shaky at the beginning of your station, please, first impression is the last impression. You may struggle, okay? First, examiner will make, and it will make an impact on the patient and the examiner as well. Moreover, it will render you, it's an automatic thing that you also start thinking that, well, I'm nervous now. There's no chance that I'm going to perform better now. Okay. So to avoid that, please practice your telephone consultation introduction properly. Okay. Now, how are you going to introduce yourself? You're going to say that, if at all, okay, read your task properly, doctors. Now, I know I'm reiterating it again, but as I always say, please don't take the task statements for granted. There is so much information. That is what is your medical history. Okay. So please read it properly. If at all it says that you are on a triage call, or if at all it says that you are calling the patient to share the results with the patient, or the patient has actually phoned the reception in the morning, and now you are calling the patient because patient wanted to book an appointment and they were worried about something, then in that case, doctors, you are calling. Okay. So when you are, I know the patient has the concern, but you are calling. Okay. So read the task properly. If at all you are calling, you will introduce yourself first. Hello, I'm Asia, one of the doctors calling from the GP surgery, for example. If you at all you are in a GP surgery, okay, GP surgery, okay, or you can say I am from the GP clinic. I'm Asia, one of the doctors calling from the GP clinic, or I'm Asia, one of the doctors calling from GMC hospital. If at all you are put in a hospital setting, okay, so say the hospital, GMC hospital, and the name of the department, okay, and I'm calling you regarding your concern, okay, or you try to, or you can say I'm calling, okay, where you who you are, where you're calling from, and you are calling regarding patient's concern in this case. Okay, today we are not talking about other phone calls, okay, the blood tests. We are talking about only where the patient has a concern. For example, here the patient's concern is, doctor, am I going to develop meningitis? Okay, so I'm calling you regarding your concern. All right, doctors. So this is your introduction part. Okay. Now comes the patient's introduction. All right, patient's introduction. Now, can I speak to Miss Eliza? All right. If Miss Eliza is already saying that yes, I'm Eliza. Yes, I called you earlier. Then no need to say this. You can just say, can you please confirm your full name and age for me? You have to find out if at all you are speaking to the same patient or the right patient. All right. So you have to confirm the name and age of the patient. Doctors, it is very, very important, the name and age of the patient. Okay. So can I speak to Eliza? All right. If at all, you can see the name in the task statement. All right. So are you Eliza? Yes, doctor, I'm Eliza. Eliza, can you please kindly confirm your full name and age for me? All right. Also, your first line of address, please. Okay. Eliza, if at all the call breaks, okay, or the line drops, is it the most appropriate number to ring you back? Okay. Is it the most appropriate number to ring you back? May I confirm, Eliza, is the more appropriate time for you to speak about this matter? Okay. So this is your introduction. Okay. If at all you want to, you think that, I will be left with less time, you can, yes, Dr. Hina, I will definitely repeat. You can skip this question. Okay. Is it the most convenient time? If you feel that I will struggle, but doctor's meningitis prophylaxis station is not a very long station. Okay. So you should be all right with the introduction part. Okay. All right, doctors. Dr. Hina said that she wants me to repeat, so I'll repeat again. Doctors, phone consultation. I'm repeating myself again. Please see the scenario properly, whether you are calling the patient or patient is calling you. Okay? Because you'll speak that way. I think, Dr. Hina, you will understand better because we give call to the GP surgery a lot of times. We are staying in the UK, so it's been a long time we give them calls, right? All right. Okay. So you will say, hello, I'm Asia, one of the doctors here, okay, calling from one of the doctors calling from GP surgery, or I'm one of the doctors Hello, I'm Asia, one of the doctors calling from GMC Hospital from medical department. Okay, and I'm calling regarding your concern. Okay, I'm calling regarding your concern, or even before telling that I'm calling regarding your concern, you can say that can I speak to Eliza, please? Can I speak to Eliza? All right, or whatever the name. Can I speak to Anne, for example? Okay. Yes, doctor, I'm Anne. Lovely, Anne. So, Anne, I'm just calling you regarding your concern. But before that, before we talk about that, can you please confirm your name and age for me? Okay, you have to confirm patient's identity. Can you please confirm your first line of address for me? Is it, if at all, the call drops? Is it the most appropriate number to call you back? And is it the most convenient time to talk about this matter? Okay, doctors, because patient could be in the middle of taking bath, patient could be in the middle of making a hot cup of tea for themselves, or they could be giving a shower or bath to their child. They could be in the middle of something, right? So you're just making sure that it's the most convenient time for the patient to talk about this matter. All right, doctors, so that's there. All right, this is the introduction part. Doctors, whatever questions I'm telling you, or any questions, for example, in your Plab exam, please don't make this mistake. Don't ask compound questions. Do you have nausea and vomiting? Do you have tummy pain and burning sensation while you're passing urine? Doctors, these are compound questions, absolutely contraindicated for your Plab exam. All right? Absolutely. How do you feel if somebody asks you too many questions altogether? No. And this is again another mistake, doctors, I pick out in mocks a lot. All right. I see a lot of doctors asking compound questions. And I'm like, which question do you want me to answer first? Okay. So always keep yourself in patient's shoes and see how would you feel. All right, doctors, I will answer whatever you're writing in chat box. I will answer your queries afterwards. All right. Okay, doctors. So that was the introduction part. Okay. Let's go to the next part. Okay. So doctors, I just wanted to cover two things at one time. I know you may get a little confused, but don't worry. I'll repeat things so that there's no confusion at all. Because I just wanted to clear not only the meningitis prophylaxis station, also the stations where patient can come with another kind of concern. For example, sometimes patients come with a concern that, doctor, am I going to develop stroke? Am I going to develop dementia? Okay. So patient can come with those kind of concerns as well. Here, it is an acute thing, okay? Meningitis, all right? Otherwise, patient can ask you about the chronic conditions as well. For example, vascular dementia, or even they can also be asking you about stroke. Doctor, am I going to develop stroke? So your first step, doctors, whenever patient asks you in Plab exam that, doctor, doctors, you are raising hands. Don't worry. I will answer your questions at the end. Okay. Because some of the doctors, it is late in some countries, and some of the doctors might be here just for, for the session. So I have to get done with it quickly. All right, doctors. Okay. So doctors, whenever the patient is worried in your Plab exam or has a concern that, am I going to develop this condition? Always ask, may I know? Okay, we will definitely look into it, Mr. John. Today, in today's consultation, we will definitely look into it. But before that, can you please tell me, what makes you think that you are going to develop dementia? Or what makes you think that you are going to develop meningitis? Well, in this station particularly, the patient might say this thing, okay? Patient will say this thing, the doctor, I had a contact with my niece, or might say, doctor, because my niece has meningitis. Okay, my niece has meningitis. That's why I'm worried. Okay, so you know the reason now. Okay, at the same time, think about other two stations of vascular dementia and stroke, where patient asks you, doctor, am I going to develop stroke or vascular dementia? Then you ask them, why, what makes you ask the same question, because the steps are the same. Okay, so you ask the patient, definitely, Olivia, definitely we'll look into it. But before that, can you please tell me what makes you feel or what makes you think that you are going to develop this disease? Now, in that case, in case of vascular dementia and in case of your stroke, patient might say, doctor, because my father had stroke, or my sister has vascular dementia, or my friend is the same age. I have got psoriasis. She also has psoriasis. And I am wondering if at all psoriasis is associated with dementia. Okay, so she has some reason. All right, so you have to tackle with the reason. Doctors, you know, doctors, scripted doctors, what do they do? They are rushing and they don't explore this further, and they go ahead and they never know, why did I fail the station? Okay, now this is your brilliant chance, your golden chance to cash a lot of IPS. Okay, by exploring this, you can cash lots of IPS. Let's suppose, first of all, let's suppose the station of meningitis, prophylaxis, where she says, doctor, because my niece has got meningitis. Well, I'm so sorry to hear about your niece, but may I know that have you seen or have you met your niece recently? No, doctor, I have not met her recently. When did you last see her? I have seen her 2 months ago. Before, she used to say, sometimes she says 1 month ago, sometimes she says 2 months ago. Well, it does not matter, because the contact with the niece has to be within a week of developing symptoms. Okay? If she has seen her 1 week prior to developing symptoms, okay, then that means she should have prophylaxis as well. Okay, but it will not matter, because she will say 1 month or 2 months. All right, doctors. So now, doctors, why I said you can cash IPS, a lot of IPS you can gain here, lot of IPS points, how you will gain that. So you have talked about how did you meet. Now coming back to your niece, can you please tell me, well, can you please tell me, how's the family coping with the whole situation? And may I know, how is she related to you? Well, doctor, she's my brother's daughter or my sister's daughter. Oh, bless them. How is your sister coping with the situation? Is your niece at home or in hospital? Well, my niece is in hospital, doctor. Okay. So how's family coping with the whole situation? Well, doctor, they are coping all right. Well, I'm very glad to hear about that. They are coping with the whole situation very well. Okay. And then come back to her concern. Okay. Come back to her concern. Now, regarding your niece again, can I please ask you questions? Okay. When did she develop the symptoms? Okay. When did she develop the symptoms? How is she feeling now? Well, doctor, she is feeling better. I'm glad. Okay. I'm very happy for her that she's feeling better. Or I'm very happy for her that treatment is actually helping her. Or the medical treatment is actually working for her. So by doing all of these, by reflecting back to the patient, you are actually gaining IPS scores, doctors. Okay? All right, doctors, this is your IPS part of the station. All right? In meningitis prophylaxis. Doctors, I'm taking both these situations side by side. Okay? Now, doctors, coming back to your dementia or vascular dementia or stroke station, where the patient says, I am worried because my sister has it, or my friend has it, or my father had it. Okay, so then you ask again, you ask about the relative, May I know? Well, I'm so sorry to hear about your father. I'm so sorry to hear about your sister. I'm so sorry to hear about your friend. How are they doing now? Well, doctor, they are feeling better now, or they are coping well with the condition. I'm very glad. I'm very pleased to hear that. Okay? I'm happy to hear that. Doctors, fancy words do not matter in Plab exam. It's not an exam of English, but speaking right sentences, understandable language is what will matter. Okay? If your language is not understandable, if you are not easily understandable by the patient, then they will mark you in language column. Okay? But no problem. You don't have to speak fancy words. All right, doctors. So you have said about that. If at all the patient is not coping well, they say the family member has died, or a family member is struggling with the condition, then I'm so sorry for your loss. If they have died, okay, then you will say, I'm so sorry. I'm extremely sorry to hear about your loss. Okay? All right. Okay, doctors. So this is the IPS part for both the stations. All right, doctors. Now it is very, very, very important to know that since when the niece has been having symptoms, when did the niece develop symptoms, and when did she meet her? These are two important questions. Doctors, I know in free sessions as well, I always tell in my course the reason for taking history for that particular station. Okay. And I also talk about, because sometimes doctors come to me and say, Dr. Asya, you know what, I failed my previous exam because of interpersonal skills. Can you just teach me interpersonal skills? Well, doctors, I'm so sorry. There is no rocket science. Every station has its own interpersonal skills. Okay? Points, which you have to catch, which you have to grab. Okay? Which you have to grab the chances to gain interpersonal skill score in that particular station. Okay, so every station is different. All right, doctors. So this is your step 1. Now let's go ahead and do step 2. Doctors, it was very easy for me to just do one station, but some doctors are just going to go into exam in coming days. So I just wanted to make sure that, as much help as I can do in less amount of time, that would be great. Okay, so that's why I'm doing this. Please, if at all you're confused, you can ask me questions at the end. Okay, that was your step 1. After the introduction, that was your step 1, asking about that, why do you believe so? Okay, what makes you think so? What is the reason they think that they may develop meningitis, or they may develop other conditions like stroke or vascular dementia? Okay, now doctors, your second step. Okay, now before I go into second step, I want to give you the reason, so that you know what, you are not, some of the courses are teaching, some online courses are teaching the history, and they are just not teaching the doctors that how to take focused history for every station. Okay, now some points are very important for that particular station. Not in each and every station you have to ask absolutely everything. For example, traveling is not at all relevant everywhere. Sexual history is not at all relevant everywhere. Okay, so you don't have to absolutely ask about everything. All right, see, in this station, for example, in meningitis prophylaxis station, do you think patients' physical activity will matter? It will not matter. Even if you don't ask, if you don't have time and you don't ask about physical activity, that's still fine. If you ask, it's good. If you don't ask, does not matter. Okay, now let me tell you the reason for taking history in this station, so that you are clear that what kind of questions I have to ask. The reason for taking history in meningitis prophylaxis station is, you want to find out, you can only allow prophylaxis if the patient has been in contact with, or if the person has been in contact with the meningitis patient within a week. Okay, so they develop, for example, they develop symptoms today, the niece has developed symptoms today. So if at all this lady, or this girl, if she had the contact 1 week, within one previous week, then she also comes in close contacts. Or if at all she lives in the same household, okay, or if at all she lives in a hostel, okay, where one person or in a dormitory or in a hostel where one person, where there are congestion, where there's congestion and people live together, okay, then if the patient was there in contact with a lot of people, then the prophylaxis is indicated. In this case, it is not indicated. So you have to rule out all of those things, that if she has met her recently, and also if at all, it doesn't matter, doctors, that if she has not caught meningitis from her niece, you have to find out if at all she has got symptoms. She could have caught it from from somewhere else. Or another reason for her having symptoms could be that maybe her big brother or somebody who's living with her from her household could have visited her niece and could have brought meningitis home, right? So asking all these questions. Anyone from your household, may I know who do you live with? Well, I live with my partner. Has your partner visited the niece at all? Okay. Or anyone in the same household with the symptoms of meningitis at all? Okay. Or anyone from your household has visited the niece at all? And also in her, your first priority is to check if at all she has got the symptoms of meningitis at the moment. Okay. So ask her that, do you have any difficulty facing the light? Do you have any headaches? Any fever at all? Have you noticed any rashes at all? Any vomiting at all? All right, doctors, you are done. Okay. These are the questions regarding meningitis. You have to ask the symptoms. Okay. All right, doctors. So you have checked contact history. How you will check? You will check the contact history, that when did she meet the niece, and anyone where she lives, whom does she live with, and anyone living with her in the house has visited her niece at all. Okay. Or anyone in the house has developed the same kind of symptoms as I have asked you early on. Okay. All right, doctors. So you have checked for the symptoms. This was the reason for taking history. You had to find out the contact and you had to find out if at all she has symptoms. Okay. Now, other things. Now, before we go into the meningitis prophylaxis station, other conditions, for example, let's assume again the other chronic stations where the patient has asked you, doctor, am I going to develop stroke? Doctor, am I going to develop vascular dementia? Okay. Then the reason for taking history in these stations is to check for the symptoms and to check for the risk factors as well. Okay. See, in the meningitis prophylaxis station, where it's related to the contact, it's a contagious condition. Okay. In that case, you are taking history because you need contact history, and you also want to find out if at all she has any symptoms of meningitis. In this case, in these two stations, stroke and vascular dementia, you want to find out if at all she has any symptoms of dementia or any symptoms of stroke at all. Okay. Which are, for example, for stroke, which question you should be asking? Any headaches, any unusual headaches, any weakness on the side of the face or body, any problem with your speech. Okay. These are your questions for stroke. Okay. And for vascular dementia, any problem remembering things, any problem concentrating on your work or concentration, any problem with your concentration these days. Are you forgetting things? Doctors ask questions wrong way. Okay. Don't say, are you forgetting things these days? Well, all of us forget things. I forget things. You forget things, I'm sure. Don't ask the question like this. The right way to ask question is that, are you forgetting things more than usual? Okay. Or have you noticed that you are forgetting things a lot these days, a lot more these days? Okay. We all forget. That is not dementia. Little bit forgetfulness is all right. Okay. But you have to ask the focused question. The focused question is that, are you forgetting more than usual, or are you forgetting a lot these days? Okay. Concentration. Regarding vascular dementia, you have to check the early symptoms of dementia. Doctors, swallowing problems and problem with eating come late stages of dementia. Early on, if the patient has come yourself to you yourself, I mean herself or himself, they are all right. They will not be late in dementia. They are early in dementia. So ask the early symptoms of dementia only. Okay. Which are forgetfulness, okay, losing concentration, okay, those kind of things, vascular dementia. All right, doctors. Or any behavioral problems, okay. Sometimes patient may behave abnormally, or even the mood problems. Sometimes they are happy, they are good, okay, or sometimes they have low mood as well. Okay. So checking the symptoms, whether it is vascular dementia, whether it is meningitis, whether it is, your step 2 is checking for the symptoms, if at all patient has developed the symptoms at all. Okay. Now step 2 is in meningitis prophylaxis was also checking for contacts. Okay. But in this case, you will check for risk factors. Okay. Risk factors can be, for example, in these two conditions, stroke and dementia, can be, risk factors can be modifiable, that means changeable, or non-changeable. Okay. Non-changeable things, for example, usually the patient in your station is elderly patient, 55, 65, 60, in that range. Okay. So family history is positive. They will almost always give you a positive family history. My father has it, my sister has it, my brother has it. Okay. And also they will be elderly. And modifiable risk factors that you have to counsel later on in your management are diet, exercise, smoking, and alcohol. You have to ask the patient, how's your diet? Can you please tell me more about your diet? Okay. Are you physically active? Regarding the exercise, you can ask like that. Smoking, do you smoke at all? Okay. If the patient says, I don't smoke, doctors, please, I notice a lot this in mock tests. Whenever I'm taking mocks, I'm telling the doctor deliberately some negative findings, especially with the lifestyle. Okay. For example, I'm saying to the patient, to the doctor, that doctor, I'm physically active. I go on walks regularly. And I say, doctor, I eat fruits and vegetables. I eat very healthy and balanced diet. Okay. And this is your chance for, again, cashing interpersonal skills. And nobody takes advantage of that. Well, very well done. Aliza, you are doing a very good thing. Very well done on following the right lifestyle. I'm very glad to hear that you're following a very good lifestyle, not hairstyle. Okay. So if at all patient is not smoking, if at all patient is not drinking alcohol, if you have less time, at least one quick sentence, very well done, keep it up. That's it. You will still be given credit. Very well done, keep it up. Okay. All right, doctors. Okay. So we are done with the history. Okay. We are done with the history. Now, meningitis station, you will ask me, Dr. Asia, in meningitis station, do we ask about her maftosa or not? No need to ask about traveling. You need to ask about her occupation. Okay. Well, Eliza, you look a bit worried. You sound, you're on the phone. Well, Alisa, you sound a bit worried or concerned about this matter. Has this impacted on your job at all? Okay. May I know, what do you do for work? Well, doctor, I work as a receptionist. You sound a bit worried today. So just to make sure, if at all this worry is has impacted on your work, doctors, if you are doing this, you will definitely score more than those scripted doctors. Okay, so maftosa, medications. M is for medications. Okay, A is for allergies, F is for family history, T is for traveling, but no need to ask about traveling here. O is for occupation. Okay, S is for psychosocial history. Eliza, who all live at home? Now you can ask the contact history here as well. Who all live with you at home? Have they visited your niece at all? Okay, have anyone from your home or where you live has visited your niece at all? Okay, or anyone from their home, anyone from your niece family has visited you at all. A is for anything else. Okay, here in maftosa. Okay, doctors. So doctors, in the normal usual history pattern, after we have ruled out, we have asked about the symptoms. In this case, no need to rule out any differentials. Okay, you will have to also ask about the past medical conditions. Okay, past medical conditions. Usually in normal history taking stations, I tell the doctors that is P2. P1 is the main complaint here. P1 main complaint is the main concern of the patient. Okay, P2 will be your medical conditions. Eliza, do you suffer from any medical conditions at all? Okay, now you will be very particular, especially when you are, if you are at all, you are doing the stations of stroke and vascular dementia, because blood pressure, okay, high cholesterol levels, heart conditions, all these, or previous clots history, all these are risk factors for developing vascular dementia or stroke. So you will ask in medical conditions, you will name them. Okay, if at all, well, John, have you been told ever that you have got high cholesterol levels or any high blood pressure? Do you have any heart conditions at all? Okay, never use medical jargons, doctors. Don't say BP. Do you have high BP? No, high blood pressure. Okay, all right, doctors, so we are pretty much done with the history part. Usually in any station at this point, you would verbalize the examination. Okay, after taking the history, you will thank the patient. Well, Eliza, I know I have been overwhelming you a lot with so many questions. We are almost done. Okay, we are almost done. Or John, I'm so sorry that I have been overwhelming you, or I've been asking you a lot of questions, but I'm almost done. Okay, and then you will verbalize the examination. But because it is a phone consultation station, can you examine the patient? No, you can't examine the patient. Okay, well, Eliza, if at all you still are worried, okay, you are still worried, see how smartly you will verbalize the examination. Okay, well, Eliza, if at all you are still worried and you are not satisfied after today's consultation, you can always book an appointment to visit us in the clinic. When you come to the clinic, we'll make sure we examine you properly. So we'll check your vitals just to make sure you haven't got any fever today. Because doctors, temperature is important in meningitis, isn't it? Okay, so we'll check your observations, particularly your temperature. Okay, just to mention, particularly, or especially your temperature, we'll check. And also we can look for any rashes. Okay, you are not calling her for the appointment, but you are just saying in case you are still worried. Okay, you can book an appointment so that we can examine you. Okay, doctors, are you understanding what I'm saying? You are just for the sake of it, okay, just to fill in the blanks. All right, you are verbalizing the examination because there is a column in your quantitative feedback where you are examined for, or where you are marked for examination. All right, doctors. Now, if at all it is stroke or vascular dementia station, definitely you will want to see the patient in the clinic. If at all it comes as phone consultation. Doctors, I have experienced this myself as well. Okay. Uh, well, I was having eye twitching in last few months when I started my first course back in, I think, April. I was having eye twitching, and it was like a total lockdown at that time. And I called them and I told them that I don't know, I have this kind of headache and the movement of my eye, this and that. I'm thinking, is it the weakness on the side of the face? So I just want to make sure I haven't got stroke or anything. So they called me in. Okay, they asked me questions first, but they called me in as well to examine. Okay, so if at all patient is concerned about vascular dementia or stroke, you will call them in, because you will say that we need to see you in detail, or we need to examine you in detail. We will start by checking your observations, which is your blood pressure, especially blood pressure. Okay, especially blood pressure, doctors. Please, examiner wants to know, doctors, if you are a focused doctor in Plab to exam, where you are pinpointing things particularly to that station, you are not sounding scripted at all, because you are just, and this way, if you take focused history, if you do focused things, you are also there are chances of passing are more, because you are not scripted doctor. You are a real doctor who has real interactions, okay, and who has the knowledge that what is important for this particular condition. Okay, so we'll check your observations. Also, we'll listen to your heart and your lungs. Okay, heart and lungs are important when you develop clots. When, for example, for vascular dementia, there can be clot, right, from somewhere else. So there can be clot. So listening to heart and lungs, and a head to toe examination, which is a general physical examination. Okay, that's why you are saying to the patient, because we have to speak in the normal patient's language, layman language. We cannot use um, the medical jargons. Doctors, no problem. I will answer your questions. Okay, doctors. Now, in case of meningitis, no need to send any investigations at the moment. Okay, uh, because you are not, most probably, you will only offer the patient to visit the clinic if at all they are worried again. Okay, but in case of vascular dementia and stroke, you will tell the patient, please come to the clinic, we will examine you, and we need to check your blood pressure particularly. Okay, or along with that, we also need to send for some blood tests, and we need to check um, some routine tests. We need to do some routine tests. Okay, particularly your cholesterol levels, blood cholesterol levels and sugar levels are very, very important. Okay, for case of vascular dementia and stroke. Okay, so blood sugar levels, write them with bold letters. I must say blood sugar levels and cholesterol levels. Don't forget cholesterol levels, please. Okay, why vascular dementia is happening, doctors, or why stroke is happening? Because of atherosclerosis. The cholesterol is collecting, right, in the blood vessels, atherosclerosis. All right, so do you not want to check the cholesterol levels? All right, okay. Okay, doctors. Next, we are on to our management and last part of our session today. Management of meningitis prophylaxis. Let's talk about it. Okay, doctors, don't worry. I'll give you a summary of meningitis prophylaxis, particularly at the end. Okay, if at all anybody has been confused with the whole approach, because I tried to cover about 3 stations here. Okay, so uh, you know what, just for you doctors, especially for the doctors who are appearing in the exam in coming days. Okay, all right, doctors. So meningitis prophylaxis management, doctors, how do you manage this patient? Well, Alyssa, what all you have told me, according to that, there is almost no risk of you developing meningitis. Okay, there is almost no risk. Or, well, Eliza, you are not at risk of developing. The good news, well, doctors, if you want to increase your interpersonal skills, talk this way. Well, Eliza, I have a good news to tell you, that you do not have a risk of developing meningitis at all. Okay, now meningitis especially is not a contagious disease as such. Okay, until or unless you have stayed with the patient Okay, you have stayed with the patient. Now you were not, we have to use whenever we are checking for the close contacts in any contagious conditions, we check that if the patient has been in contact recently, especially 1 week prior to the symptoms, and you has, as you have mentioned, you haven't seen your niece in last 2 months. Okay, which is for good. Now, secondly, Eliza, if at all, well, doctor, are you not, well, doctor, they gave some medication to my sister and her family. I was just wondering, am I going to, do I need any medications at all? Well, Eliza, if at all you needed a medication, okay, it's a good thing that you told me that your family has been, or your sister's family or your niece family has been given some medication. Now the medication they are given, we call it prophylaxis. Prophylaxis means prevention, Eliza. Okay, we give it to the close contacts of the patient to prevent the disease in them. Okay, whereas you are not at risk. Let me reassure you, Eliza, we have a dedicated doctor, I'm going to tell you what is CPHD. Okay, well, Eliza, we have a dedicated department in the hospital. Okay, we have a dedicated department in the hospital, in every hospital, say in every hospital. Okay, which we call as public health department. Okay, and the consultant, CPHD, is C for consultant, P for public, H for health, D for department. Okay, consultant in public health department analyzes the situation, and they will find out the close contacts, or they will trace the close contacts of the patient, and they will also contact them in order to give them prophylaxis antibiotics. Okay, prophylactic antibiotics. Now, Eliza, that is given as a single dose. It is just given one antibiotic one time. But let me reassure you once again, you don't need it. Okay, you don't need it. If at all you fell in that category, they would have contacted, the department would have contacted you themselves. All right, doctors, I hope it is clear to you. All right, doctors. Now, what is very important to increase your chances of, doctors, please mute yourself, of passing every station is always safety netting. Safety netting is, it always increases. That's why I say that doctors, please take focused history, try to come to management. It is always good to get 2 in or 3 in IPS, 2 to 3 in data gathering, instead of taking a long history and getting 4 in data gathering and getting 0 in management. All right, so please take a focused history, verbalize examination, come to management, and do safety netting. Okay, trust me, safety netting will increase your chances of passing Plab exam. Okay, so safety net the patient. Now in this patient, safety netting would be symptoms of meningitis. Okay, so you will say to the patient, if at all, Eliza, during these days you develop any high fever, okay, any high fever, any rash, you feel or you find it difficult to face the light, you have any continuous vomiting, please come back to us. Okay, or please call us right away. Please come to hospital, or please call us right away. Okay, and I know it's very difficult, Eliza. I'm sure you must be missing your niece, Eliza. Yes, doctor, again your chance of catching the IPS again. Okay, so, well, Eliza, I'm sure you must be missing your niece. Yes, doctor, I'm missing her a lot. I haven't seen her in a long time. Well, Eliza, it can be very difficult sometimes, but we have to take steps sometimes just for everybody's safety. So it is advisable, Eliza, until or unless your niece is recovered, please do not visit her. And anyone living with you at your home, also advise them the same. Doctors, you will pass this station with flying colors if you have approached it this way. Trust me. Okay, so there you go. Now coming to the management of other chronic conditions. Okay. For example, where your patient has concern that, doctor, am I going to develop dementia? Okay. Doctor, am I going to develop dementia or stroke? Okay. So in them, how do you manage the condition? First of all, most important thing is telling the patient again, instead of telling the provisional diagnosis here, what is your provisional diagnosis? Well, John, may I know how much do you know about vascular dementia? May I know what do you know about stroke? Well, doctor, I don't know anything. Or I think that you have weakness, you have, yes, you are partially or you are almost right, David. Or if the David doesn't know at all, if John doesn't know at all, well, David, don't worry, I'm going to tell you. Okay. Then give the definition. Okay. Give the definition what a stroke is or what vascular dementia is, and then tell them that, well, John, there are two kind of risk factors for developing this condition. Okay. Some factors are such that we can't do anything about. For example, which we can't do anything about, unfortunately. For example, in your case, your age and your family history as well, unfortunately. Or unluckily, your family history as well. However, there's a good news, John. There are some risk factors we can modify them or we can change them, and you can still avoid developing this condition. And those are regarding doctors. If you have less time and you have picked out that patient does have the risk factors of diet, physical activities, which is exercise, or they are smoking a lot. Okay. If you have picked out in the history that patient has some problems and you have less time, you can always say that we will talk in detail. Okay. We will talk in detail in another appointment. If at all we are not able to cover here, in today's consultation, we will talk in detail. I can even I have noticed that there are some problems with your diet, John, and we have to talk about it. Or you can even simply say that regarding your diet, you mentioned you are eating out, you're eating lots of burger and chips. Now these kind of foods contain lots of oil, which is not good for this condition. So it is advisable. Doctors use good words, okay, good words. Advisable. Don't be judgmental. Don't be pushy. Don't be bossy. Don't say, well, John, I will tell you, you have to follow this lifestyle. No, you are not the boss. Patient is the boss, okay? Here in the UK, in NHS, patient is the boss. So you will say it is advisable. It is recommended, okay? Well, John, it is recommended that you, instead of eating fried food, if you eat some grilled or steamed food, give the different options to the patient. Like you can pick up good healthy food options from your supermarket these days. If at all patient has mentioned that they are busy, they don't have time for cooking, well, John, there are many options. Ready-made options as well can be healthy sometimes. How about batch cooking? John, you can cook in one day in a week and you can freeze it and use it throughout the week. Give that kind of options. You will be different than other doctors who are scripted. Just they memorize the paragraphs from the script and go and through. Doctors give advice according to the patient's problem. Okay. If at all there is problem with diet, talk about diet in detail. If at all they are not following good physical activity routine, tell them that they have to be physically active. 30 minutes at least 5 days a week is recommended. Okay. So you don't have to do that all in one go. You can do it differently. You can do it by maybe going up and down the stairs 5 minutes. You can even park your car a bit far away when you go for your groceries. Recommend different ways. Talk to a friend. Talk like when you are talking about the lifestyle. Now, lifestyle modification is very, very important for stroke and vascular dementia station. Please do it properly. Okay. If at all you have found out that there was some problem with patient's BMI. Okay. Also in examination, sometimes the BMI is given in your task statement. And if such was the case, please talk about the BMI to the patient. Well, John, when we checked your height against your weight, we have noticed that it is unfortunately towards higher side, or it looks a bit towards higher side. What do you think about it? Well, doctor, yes, I know I have gained some weight. Well, we have to work regarding that as well, because again, obesity is a risk factor for developing vascular dementia or stroke. Okay, doctors? All right. Also mention just a line about Q risk assessment. We will consider all these factors, your diet and all, and we have to find out your risk of stroke. There's a guideline, it is called Q risk assessment, and we'll find out your risk of developing stroke with advice of my senior, okay, or consulting the guidelines, you can say. Now, the medications, doctors, that you can talk about in vascular dementia and stroke station, you can say that if at all we find out in blood test results that your cholesterol is high or your blood pressure is high, my consultant, or you can say my senior, might prescribe some medications for that, okay, for high cholesterol or high blood pressure. Okay, safety netting the patient in these stations for symptoms of stroke or symptoms of dementia. If it at all, it is the dementia station where the patient says, am I going to develop dementia, doctor? You have to tell them, if at all, John, you develop any weakness or numbness on the side of your face or your body, or you have any problem with your speech, or you have any frequent headaches, please ring 999 and come to hospital. Dementia, again, the symptoms that I told you initially that you have checked for. If you are forgetting things more than often, if at all you are you can't keep your concentration, or if at all your mood is low, please let us know. Okay, please let us know. All right, so safety netting for both of those stations. All right, doctors, again, now the summary of meningitis prophylaxis once again. Okay, summary. Now, doctors, first of all, phone consultation, the introduction is very, very important. Do the introduction properly. Introduce yourself first. Get patient's introduction. Please check their first line of address. Check if it is the most appropriate number, phone number, to ring them back, okay, if at all the call drops. All right. Okay. So number one step in meningitis station, find out, okay, why she is concerned, or why does she think she's going to develop meningitis. Okay, explore the reason properly. When have you seen your niece? I'm so sorry. And catch your IPS scores. Okay, she'll give you a chance for catching. The niece is the point of catching interpersonal skills. Okay, so talk about niece. How is she related to you, and how the niece family, if at all it's brother's daughter or sister's daughter, how is your sister's family coping? Well, I'm glad they're coping well. Okay, and then after that, aim to take the history. Your aims of taking history in this station is to find out that when did she see the niece, if at all she has got any symptoms of meningitis. Now, if at all anyone from her household has visited her niece, okay, at all. All right. Okay. Now, after that, after taking the history, okay, that part of the history, symptoms and contact history, you will also check for just, a general quick lifestyle questions. Okay, how's her diet? Is she physically active at all? Does she smoke at all? If you think I have less time, lifestyle is not very important here. Okay, so you can skip that part. Do ask about past medical conditions. Do ask about medications. Do ask about allergies, yeah, the family history of any medical conditions. What do you do for work? Okay, you are worried, you seem worried today. If at all it has affected your mood, or at all if it has affected your work. Okay, if at all it has affected your work. That is occupation in MAFTOSA, occupation. All right, okay. Psychosocial, in S is psychosocial history. Who all live with you, and how are they feeling these days? Okay, is everyone well at home? Okay, okay. Then verbalizing the examination. You can't examine her right now, okay, because she's over the phone. So you can say to her, If at all, Eliza, you are still worried after today's consultation, you by all means, you can book an appointment with me, or you can book an appointment with one of the colleagues in the GP clinic, so that we can examine you and we can see if at all there are any rashes. We would like to check your temperature as well, okay, when you come. All right. Then doctors, you will tell her the management. Okay, what is the management? Well, Aliza, I've got a good news. You do not have any risk of developing meningitis, because fortunately you did not visit your niece when she had the symptoms. Okay, so medically you had to visit her 1 week, if at all you had visited her 1 week prior to her developing symptoms, then you would be at risk. Okay. Well, Eliza, let me reassure you, we have a dedicated department as well, which is public health department in every hospital. The hospital where your niece is admitted, they would have contacted you by themselves. Usually, well, doctor, the medication, my niece family or my sister's family has been given a medication. Do I need that medication? No, Eliza, you do not, as you do not fall in the category of close contacts, so you do not need that medication. If at all you needed that medication, the department would have contacted you by themselves. And okay, how to contact you? All right, okay, doctors. So here, doctors, I'm going to give my phone number and I will put the link for the Telegram group as well. Okay. So I will answer your queries, doctors, in a minute. Okay, this is my phone number. And let me give you the link to my group as well, if at all you are not part of the group. Well, doctor, I'm always very uncertain about my courses, because I need to do locum in between. Okay. And I'm waiting for my permanent job. So I am very, my right now, it is very unpredictable. When will be, I cannot tell you that when will be the next course. Okay. You're welcome, doctors. And let me see now the chat box and the big revelation, if at all today has been anybody rude. Okay. Okay, let's see. Can you confirm your name and age? Well, Dr. Coco, you said, can I speak with Anne? Now, Anne is not the full name. There can be different Annes, okay? There can be, with the same name, there can be different people. Maybe she is Anne and her cousin Anne is here as well, okay? Maybe her cousin is visiting. So the call could be for the cousin Anne, for her, and the cousin Anne would have picked the phone. Okay, so make sure you're talking to the right person. That's why you will want to confirm her full name and age. Okay, so that you may want to make sure. Asking double barrel question is a sin. Avoid it. Okay. Hi, doctor, I'm new here. Can you please guide how to start from scratch? Doctor, stay here. You will learn a lot. Struggling in a day-to-day activities, cooking, driving, for stroke. Okay. All right. Okay. Okay, doctors. So, doctors, regarding the course is starting from 8th of September. Okay, it's a 2-week course. And if anyone wants to know that what all I cover in the course, you can contact me on my number, or you can contact me. You're very welcome, Dr. Ortega, Dr. Christian. Yeah, Dr. Christian. You're very welcome. Welcome, doctors. Welcome. All right. So, doctors, do let me know if at all you're interested in mocks or you're interested in the course. You can let me know. Welcome, doctors. You're very welcome. Anyone has any questions, any queries? Dr. Tathir is from our batch 1, and she's saying, Doctor, even when you get a permanent job, please don't stop doing Plab 2 courses. Okay, okay, sweetheart. You and I, we will have to come together to do this then. Okay, it will not be possible for me to do alone then. Dr. Tathir, pass Plab 2 quickly. Okay, we'll do it together. Okay, yes, Dr. Krishna. Yeah, sure. I love you. I know you're brilliant and you're going to pass in one go, Dr. Tathir. So yes, but please don't get this overconfidence to your head. Okay, please still keep studying. Yes, doctor wanted to know about the course. Yes, doctor, it is a 2-week course, and if you want to know what all I cover, please contact me through my number. I have given the number here. All right, I'll send you my number again. Okay, doctors, regarding the course, I cover almost all categories of the station. It is not possible to cover all the 350 stations, but I try my best to cover all the categories of the stations. Okay, and the course is £150 if you are only one person attending. If if you 3 friends are attending and you want a discount, it's £100. Okay. Yes, it includes materials. It includes your notes. Okay, I give you notes. You can use my notes for revision. Trust me, nobody gives you notes for revision like that. Okay, so you can use my notes for revision. I do make notes for history. I do make notes for for management as well. So you get notes along with the course. You don't pay any extra fee, unlike other courses, for the notes. Okay, and you're welcome. Thank you, Dr. Maya Sunil. Okay, now I also, if at all you miss any day, okay, during the course, I know doctors are very busy. There can be unprecedented situations, so I give you recording of that day. Okay, if you miss by any chance, but if you keep on asking me recording every day, sorry, I won't do that. Okay, you will be given access for a couple of hours only, so you have to make sure that you get done whenever you ask me for a recorded session. You have to you will only be given permission for for a particular time. Okay, all right, doctors, that's all. That's pretty much it. Anyone else? I'm going to unmute all. Anyone else has any queries regarding the course, regarding Plab 2 stations? I'm here for another 2-3 minutes. You can ask. Thank you, doctors. Doctors, Rafiat, September course is starting from 8th, okay, from the 8th. All right. Anyone?
Dr. Asia, you had given the 18-1 stations, or it was a 15-1 for you?
When I took the exam, it was 18, yes, 18 stations.
Okay, and would you mind telling us your score?
Yes, I scored 16 stations I passed, right, out of 18. Yeah, and to be honest, I don't remember my passing score at the moment. Okay. But I did clear 16
stations, so that was really great.
Thank you, doctor. Thank you.
Do you have any sessions between now and 8 September?
Yes, I'll try my best, doctor. I have my hair appointment on Saturday. So I'm thinking maybe if there are not a lot of hair dryers or a lot of noise, I'll try to do, some, because I'll be there for a couple of hours. So I'm thinking maybe I'll do something on Saturday. I'll try to do, my husband is traveling tomorrow and day after tomorrow, but I'll try my best to do some
how would we know? How would we know about if you have any session in between?
Couple of hours before the session, I post in the group. Okay, are you part of my group, doctor?
No.
Let me
Can-
post the link. I have just posted the link to the group in chat box. I'm going to do that again. Okay.
Please, yes, that would be great. Yeah.
Sure. Doctors, whenever doctors are part of my group, I try my best that maximum, you get the benefit while you are being in my group, because that means you are with me when you are my group. So I want to help you. Okay. Whenever doctors in between the courses, I'm free. For a week or two, I always conduct free sessions. So don't worry if you're in the group. Oops.
Dr. Asia, you also mentioned about the mannequins and the Siemens. You said that there are certain academies who just allow you for the mocks. And so is it all the academies, do they allow that, or it's a particular?
No, there are only, I think, 2 academies who offer, not all of them.
And which are they, if you can tell us?
Friends, I know for sure. I also heard about common stations, but you have to check. Okay.
Both are in
Some
London?
one is in London, one is in Manchester. Friends is in Manchester.
All right. Okay.
Okay.
Thank you.
You're welcome, doctor. You're welcome. Anyone else has any queries, any questions?
Thank you, doctor, for the session today. It was useful.
Okay, lovely. You're very welcome, doctor. You're very welcome. It's my pleasure. Okay. Yes, doctor. Dr. Christian, we have a mock together. Okay, so if at all I'm not able to discuss anything here, you can discuss with me. Okay, by the end of our mock, you can definitely discuss with me. Okay, but I'll try to do my best. I'll try to cover these 2 stations. Okay, before your exam. I know your exam is very close. So I'll try to do EpiPen and cystic fibrosis. All right, don't worry. I'll try my best.
And last question.
Yes, doctor.
Your course, does it include face-to-face practice or is just online?
It's just online, doctor.
Okay, good. Thank you.
No problem, doctor. Okay, doctors. We are pretty much done. No questions. If no questions, then I'm going to leave, doctors. Okay.
Thank you.
I'll post the notes, the slides in the group. Okay.
Thank you so much, Dr. Asia.
Thank you.
No problem at all. No problem. Okay, doctors, best of luck and take care. Have a lovely night. Okay, sweet dreams. Take
Same
care.
to you. Thank you. Bye.
You too.
Thank you, doctor. Bye-bye. Allah Hafiz.